Hi everyone, welcome back to the Dr. Siha channel. In the video here today, we're going to be talking about yet another defense mechanism that I really have had a lot of insights about lately, so I'm really excited about sharing those, and that's called the defense mechanism of distrust. Let's get started. Now, the defense mechanism of distrust is something that all therapists deal with. And in fact, people who are dating, people who are having friends, whatever, every one of us has encountered distrust, either felt it, experienced it for ourselves, or being distrusted. Now, typically what happens is when we're distrusted, we try our best to show the person how we're not harmful. We open ourselves, we spill ourselves, say, look, I'm not harmful. Look how unharmful I am. Look how safe I am. No, I would never hurt you, and so on and so forth. And then somewhere down the line, you do something that's hurtful, and then bang, that distrust is completely broken, and now you're on the outside where you used to be. Actually, you were already at the outside, because if you have to still keep proving yourself to someone over and over and over again, you're always on the outside anyway. But so what do we do about distrust? Well, first of all, the way I look at distrust, obviously, projection is involved. But to focus on distrust per se, it's like the patient is saying, look, I ought to trust you immediately. Sitting down here in this room, I ought to trust you immediately, but I don't. Now, first of all, I don't know if people should immediately trust anybody. Yes, therapists are meant to be safe people. No, we're not always safe people. Like, there are examples of therapists causing harm, therapists engaging in unhealthy behaviors with their patients, and so on and so forth. So a blind distrust is not what you ought to be looking for as a therapist, and not what you are expected to have as a patient. Rather, so here is my twist on it, and I think it's really useful, and I think it's really helpful. Rather, what you would want as a therapist is for the patient to be able to collect data, to use their own eyes, their own ears, their own feelings, to be able to discern moment by moment whether you are being harmful or not, whether your eyes that they see are caring eyes or dismissing eyes or uninterested eyes, to look into your eyes and see that for themselves, to hear with their ears whether your voice is a caring voice or not, and to be able to then, in essence, trust themselves. It's not up to the therapist to help a patient trust them. It's up to you as the therapist to help the patient gather information about the relationship they have with you and trust that information that they've gathered with their eyes, with their ears. My eyes are seeing a caring person. My ears are hearing a caring voice. The feeling that I have here, bar the anxiety, might be one of connection. Now, if you can help a patient do that, then you actually help them do something that's far more valuable than blindly trusting that you're a good person. You help them become discerning information consumers and gatherers. You help them trust their own eyes rather than their anxiety, their projections, their misunderstandings, and so on and so forth. And any good therapist, any effective therapist, will effectively help the patient trust themselves. Now, you might never have thought about it that way. You might have thought, well, I was just trying to help them trust me, believe me. But really, there is no such thing as believe that you are safe and harmless. The only thing that we have is information, the best available information up until that point. And if that information changes, I would expect my patients to change along with it. So if someone is, for example, kind and nice and nurturing to them to start off with, but then turns into violent or abusive or neglecting or so on and so forth, I expect them to trust that information too. To go, okay, well, I trust my eyes, my mind. I saw someone helpful, healthy, caring, so on and so forth. Now what I'm seeing is someone uncaring, harmful, abusive, and violent. I'm going to trust that information too, and I'm going to take action accordingly. So if we help people blindly trust others, we might not be helping them do the right thing. But if we can help people trust themselves that the information they gathered shouldn't be doubted, denied, rejected, attacked, dismantled in any way, minimized, then we can help people separate between their anxieties, their projections, and their trust of the information that they gather. I hope this was useful to you. I hope you enjoyed it. I hope you find this, my version of an expose on distrust and the way that I work with distrust, useful to you. If you did, let me know, and I'll create some videos around how to work on distrust separately with the different attachments, sort of a disorganized attachment, avoidant attachment, and ambivalent attachment. But if you enjoyed it, let me know, and I'll talk to you again next time. And I'll see you again for the next one. How do I normally end? It's early in the morning. It's very early.